the department will need to be transferred. Second thing, recent history and chronic diseases. Then, again, your assessment. Easily open the chart, you have assessment part, you documented your assessment, right or wrong? So all of us, all of the department have a chart to document their assessment. Just open the assessment and go systematically highlight the abnormality. And I advise connecting this with your lab result and medication. So for example, now I have assessment for renal function. Connect this with how much electrolytes levels and how much urea and creatinine. When I speak about cardiac system, I am speaking about if they have abnormality in troponin level and CK and my abnormal ECG, right? When I go for respiratory system, I'm speaking also about my abnormal EBG and X-ray if I have. When you go for your GIT system, you're talking also about bowel motion, if there is culture, if there is urine analysis, if there is stool analysis, etc. And you are connecting between the assessment and lab result and whatever medication. And for example, your patient have no bowel motion, you're connecting it to maybe the doctor asked for stool analysis and CDF, maybe he is asking for to give lactulose, right? So you are connecting three information in one system. So this is your assessment. So systematic review through chart and identify problems needing care. So during your assessment, you are mentioning constipation. You mentioned sputum, secretions. You mentioned arrhythmia, right? You mentioned decreased urine output. In the assessment, right? You say last urine output, it was decreased. You saw last bowel motion, it was less than ideal, it was less than once time per 24 hours, it was very hard slow or high frequency. You saw that the patient have difficulty breathing. Okay, so this is problems, right? This problem needs your nursing care plan. So your recommendation is your nursing care plan to the problems you found in the assessment and background and situation. Okay, so chronologically here, when you reach the recommendation, you're already thinking about the problems and how to solve them. So you receive this information as a day shift. From night shift, you are working on the same nursing care plan. It was implemented before. They are continuing the care. You get it? That's why SBAR is important. It will prepare you to work the same method your colleague worked before. This is the benefit of handover. You are continuing the care. Continuing the care. If you make a message that is so disorganized, your colleague need whole shift to understand the patient again. So this is no benefit from handover. So the handover has not only to give information, but also to prepare the person to continue the same care. So it makes sense? So you find, you grasp the attention, what's the main problem? Then give a backstory about this main problem. Then what's your assessment? I defined 1, 2, 3, 5 problems. These 5 problems is my recommendation. So where is the physician order? You connect your assessment, your own assessment, with the current medication, with the current highlighted lab, and the current orders. This is during your assessment, you are mentioning your assessment and current labs related to the assessment, and current medication related to the assessment, and orders related to your assessment or system. Okay? Right. Then you take out the problems and treat them in the recommendation. Let's say part of the recommendation is pending orders. Yes. Let's say pending X-ray, pending CT. Today plan for CT. Today plan for X-ray. Today plan for drain removal. Whatever is in the recommendation. Nursing care plan and pending orders to be continued in your shift. Okay? So remember, it's a complex message can be delivered via simple SBAR process. So you have to speak in a way that attracts people and grabs their attention. And when you do that, you save your colleague time. Let's say you did this first shift. Your colleague will be happy. He will work directly. When the first round comes in the morning, he will be very ready. And he will be expecting patient problems, and he will be very mentally ready. He will be very mentally present. Okay, I did all this effort, so my colleague will be more relaxed during the shift. But when you come in the night, he will do the same way with you. You will be also relaxed in your shift. imagine that your stress is more than half is mental and psychological stress. If you organize your thoughts, if you know what you should do exactly, and you organize your work, you will eliminate very huge amount of this mental stress. Then you can concentrate on work. You have less things to worry about. Okay. طيب, let's say example here that we have a scenario that we will ask each group, so one group, two group, and three groups, to do one scenario. So in scenario 1, this group, let's say you have Mr. Muhammad B in ICU room 12 who is coming to ER with right side chest pain. You get your name? Yes. Okay. And difficulty breathing. You have an order for PE study. You know what PE is? Okay. And creatinine elevated is 2.9, and you have to clarify with Dr. Ali. Why you have to clarify with the creatinine level PE study? Because you will give contrast. So how can you order this information through what is related to SBAR? Yeah. You have just 2 minutes. Think about it. You can read it properly. Anybody think the font is small? I can enlarge it. Sorry, this is that one. Yeah. What we say to put in S?
Situation. Right side chest pain and difficulty breathing.
Okay. First, don't forget the important things. Identify the patient. So I have to put here what? Huh? Okay. You are. What's your who you are? For example, Ahmed or Muhammad or Ali, or your name. Okay. Identify yourself. Then speak about the patient, right? So go ahead. Okay. So you will say in the S, the patient have right-sided chest pain and difficulty breathing. What is in B?
Pulmonary embolism study.
Huh?
Saturation creatinine.
Exactly. So what is it? Why you are falling? Why you are falling? The patient already have PE order for the chest pain. It's nothing new. The situation is that you have creatinine high and you have to do BE. So you are concerned about the creatinine level and the BE study. The patient will receive contrast. It will affect the kidney. So this is your situation. What's your background?
Background right side.
Okay.
Difficulty breathing. Right side chest pain.
So what's your assessment? What will you say to put in background? Recent history. Right? So what's the recent history?
He came
to with right side chest pain. Okay? Yes, and and difficulty breathing. Now, your assessment is creatinine level is 2.9. What's your recommendation? To clarify with the doctor and check if he will receive contrast to do this study or not. Okay? Fine. طيب. Next group, Mr. Jamal in ICU room 5. He is resting comfortably in his room and he's done surgery 2 days ago and he has a history of AFib and has been going in and out of controlled AFib since his surgery with rates of high 90s in the morning, in this morning, and with a rate of 120-130 range. He is currently asymptomatic on medication like Coumadin. He was on Coumadin 5 milligram per day and digoxin 0.25 milligram per day before the surgery. He was on this medication before the surgery, but he didn't have any of this medication since the surgery. His vital signs are stable, blood pressure 120/80, but you have to speak with Dr. Ali. You have to identify what is the situation.
Increasing heart rate AFib.
So situation is, first how you will start the situation.
Patient name.
Patient name. So patient name is here. Patient name is here. Yeah. How you will speak to the doctor? Like I am the doctor. How you will speak to me?
Mr. Jamal, ICU room 5.
Yes.
This patient now have the AFib. Heart rate reached to 120 to 130.
Okay. Type. B.
This patient, he done hip surgery 2 days ago. And he is on warfarin and digoxin for surgery. And he didn't receive after surgery.
Okay. What is A?
Our
Vital signs are stable.
blood pressure 120/80, heart rate 120 till reach to 130. And he is asymptomatic.
Yeah. And he is also resting comfortable in his room.
Asymptomatic.
Yeah. You can add that he is comfortable, doesn't have any symptoms, doesn't have complain of pain, etc. So what's your recommendation?
I asked the doctor when should start warfarin again and the injection or no.
Okay. So this is how to use this. But let's say the scenario. So, for example, you start by calling the physician by name and mention your name and just, I'm caring for Mr. Jamal in CCU room 5. You have to identify the room. And he had change in his heart rhythm. So new AFib, like she said. Next one. He have 2 days surgery since 2 days, and he has been going in and out of controlled AFib since his surgery with rate of high 90s. And he have history of AFib. He was on Coumadin and digoxin prior to his hip replacement surgery, and he didn't take the medication since the surgery. This is your background. Assessment. So you are mentioning your assessment. This morning, Mr. Jamal has gone into a uncontrollable AFib with rate in 100, 120, 130 range, and is currently asymptomatic, vital signs are stable, and blood pressure 120/80, and he is resting comfortably in his room. So this is your assessment. Recommendation: do ECG, right? For example, I would like to his digoxin Coumadin to resume. Consult cardiology, right? This is all options. Or are there any other tests you would like to order? You ask the physician if he asks any other, need to add any orders. And I will call you if Mr. Jamal converts or become asymptomatic, or sometimes would like me to call you with any other information. So you ask him if he want to any triggers to call him again if any change in the condition. Maybe he will ask if the heart rate increase more than 130. Maybe he will ask if the blood pressure become less than 120. This is next time to call me. He will tell you what is the trigger. It's very simple. It's very simple. But when you start organized. Every single time. Every single time. Your brain is already formatted to this way. So this scenario, last group, sorry. Mr. Tariq, 22 years old, in ICU room 27, has pain as 9/10. Very minimal pain control since his surgery, with quality of being sharp and radiating to his mid-calf area, post-surgical repair of fractured ankle 2 days ago. His first time having any type of surgery or significant injury. He is on Tylenol, 650 milligram Q4 hours for minimal or moderate pain, and morphine, IV, 1 to 4 milligram Q2 hours for severe pain. Allergies, no known allergies, you have to inform Dr. Majid. Again, now you try to do it as perfect as possible. Don't forget any element of the SBAR. How you will start?
Situation, first of all, patient identification.
Hey, go ahead. Fill the gap. Fill the gap.
And situation, Mr. Tariq, 23-year-old patient.
First, introduce yourself and call doctor by the name as opening conversation. Just imagine that you are speaking with Dr. Majid.
And doctor, we have patient name is Tariq, 23 years old. In room 27 has pain as (9/10) was very minimal pain control since his surgery. So this is the situation. Then with the quality of being sharp and radiating to his mind cuff area for surgical repair of a fractured ankle 2 days. Then this is a background. Then he has a fractured ankle 2 days ago. This is first time having any type of surgery or significant injury. This is also background, and then we have to assess medication. This is assessment. Can we?
Simply, what is your own assessment? Background is the things that is before condition of the patient. Okay? Current things and your assessment is in the assessment.
Current any medication is assessment. Medication taking on 650 mg is taking 4 hours for minimal to moderate pain, and morphine IV 24 mg 2 hours for severe pain. And
No known allergy. NKA, no known allergy. Type. Where is the recommendation? What's your recommendation? What was the main problem? Okay.
Medication, we have the recommendation medication.
Anybody can speak from the group, no problem, not one person. You can add. Sorry? Reassess the surgical site, can be yes. I cannot hear you. Raise your voice. You can increase the dose of analgesic. Just listen. Then? Sorry? Yes?
List of medications, Tylenol 650 mg
This is
for
recommendation.
Ah,
Tylenol,
if the patient is from moderate to severe pain.
I so for
To increase.
Yeah.
To increase. Okay. So recommendation to increase medication, they assess the surgical site. Okay. Right. Let's say what you should say in the situation. So first you greet and say, Assalamu alaikum, Dr. Majid. This is your name from ICU. I'm calling from Mr. Tariq in room 27. I'm calling regarding his pain control. Right? So this is a good conversation starter. Then the next one is to say, Tariq is 22 years old, has surgical repair of fractured ankle since 2 days. He had very minimal pain control since his surgery. He has an order for Tylenol 650 milligram, Q4 hours for minimal to moderate pain. Once IV, 1 to 4 milligram Q2 hours for severe pain. He does not have any allergies to medication, and this is his first time having any type of surgery or significant injury. You can see the size of the situation is always small. Background is a story. Okay? So always it's like a title. Situation is like a title. Background is the details. Right? Then your assessment. Mr. Tariq ranks his pain as 9/10 because it's your assessment, right? These things, not your assessment. This is background. Your assessment is the pain. Quality of being sharp and radiated to his mid calf. You assess him and he is reluctant to ambulate out of bed, and he even refusing to get into a chair at the bedside. He having limiting pain. His pain is limiting him from mobile. And his vital pulses are equal, the surgical site is within normal limit, and all of his vital signs are stable. So your assessment is like that. So what is your recommendation? I think Mr. Tariq would benefit from some longer lasting pain medication. Like say he is on already good dose of this medication, maybe he needs something that is longer lasting. And he would like prefer to order, what would you like to prefer to order? Are there any exam or labs would like to be ordered? What should I call you for in future regarding his pain control? So you suggest, like you exactly did, medication changes, reassessment, and also emphasizing how you call him next time after the intervention. Okay, I will give this dose when I should call you next time. Okay, he may say if the pain persists. He may say if the